Hello, my name is Stacy Mulo. I'm here to speak to you today about access to state medical marijuana programs for veterans. Currently, there are 23 states plus Washington, D.C. that have enacted the Compassionate Care Act, which allows for individuals with severe medical conditions including HIV, AIDS, ALS, Parkinson's disease, multiple sclerosis, damage to the nervous tissue of the spinal cord, epilepsy, inflammatory bowel disease, neuropathies, Huntington's disease, in addition to wasting syndrome, severe or chronic pain, severe nausea, seizures, severe or persistent muscle spasms caused by severe medical conditions. Access to care is provided through an individual's physician. Physicians have an option to take a 4-hour training and registration course to be able to issue medical marijuana program certificates. If a provider chooses not to participate in the program, they are able to make a referral and provide recommendation to a current registered provider. There are currently 514 physician providers and nearly 2,500 participants in the New York State Medical Marijuana Program. A current Veterans Health Administration directive entitled Access to Clinical Programs for Veterans Participating in State-Approved Marijuana Programs dictates the prohibition of VA medical providers from completing forms, providing recommendations, or opinions for participation in state medical marijuana programs available through the Compassionate Care Act. Additionally, if a veteran presents with a state medical marijuana program certificate, the VA will not provide marijuana, nor will it pay for it to be provided by a non-VA entity. The VA currently services nearly 8 million veterans. Medicinal marijuana has a long-standing history in the Western culture, of use dating back to the late 1800s. This was halted in the 1930s with the Marijuana Tax Act. Research has shown marked improvement and decrease in muscle spasms and chronic pain for those treated in clinical trial. Many veterans are inflicted with chronic pain due to service-related injuries and would subsequently benefit from access to state medical marijuana programs. There is also current consideration of inclusion of post-traumatic stress disorder for state medical marijuana programs, another condition that many of our nation's veterans struggle with. Veterans who utilize Veterans Health Administration medical services are forced to independently seek registered providers in the community independently for access to this type of care. This interrupts care and the doctor-patient relationship, as the community providers are not familiar with the veterans' medical histories and past and current treatments. This is also tiresome and costly for the veterans to have to access the same medical care that the rest of the population does. 2 current legislative bills are in progress, however, they're not approved. One is the Veterans Equal Access Act. Another is the Compassionate Access Research Expansion Respect States Act of 2015. Both of these acts plead to the VA current policy of prohibiting medical providers. A current goal is to change the VA directive to be inclusive of VA physicians fulfilling state medical marijuana regulations. Congress has attempted to pass legislation to change the current regulation, however, has currently been unsuccessful in doing so. Veterans have organized rallies statewide to protest their right to equality and access to care to medical marijuana. A current solution is to continue to rally, to organize a rally to picket in front of the Office of Veteran Affairs in Washington, D.C. Picketing allows for a group of people to be seen and heard. It shows the alliance of a group to advocate for their interests and needs to be met. It calls for change and reform to current policies. Organizing a rally to picket for veterans' equality of access to care will speak volumes to the VHA. Social movements and picketing are an effective notion of disruption in order to provide a voice to a group determined to be heard. The importance disruption offers in influencing negotiation through implementing urgency and necessity for progress. Picketing not only allows for a voice to be heard, it also makes a profound statement to show unification and support for those who are fighting for their rights. This form of macro advocacy success is evident through the use of persuasion, publicity, and exclusive advocacy. Picketing is effective as it appeals to the immediate and long-term emotional oppressions, causing discomfort while addressing the targeted audience. Offering a social network to collaborate and advocate for a common cause perpetuates empowerment, unification, and forms alliance. I ask you today to form an alliance with me to fight for our veterans' rights, to rally at Washington, D.C. at the VA to hopefully implement a change in the current policy that is holding veterans back from receiving the care that they need and having the same access to medical care as the rest of the population. Thank you.